All right, well, it's 11 o'clock, and I know that there's a lot of ground to cover. There's questions to be answered, and I want to make the most use of our 90 minutes here in the building before they kick us out. So we were very fortunate to be able to secure this space for this meeting. So thank you all for being here, and thank you to the City of Longmont for opening up the council chambers on a Saturday. Not a usual work day. So my name is Representative Karen McCormick. I am the state representative for House District 11, which is basically the majority of the city of Longmont. So if you live in Longmont, west of Pace, most likely I am your state representative down at the General Assembly. I'll let our senator introduce herself, and then I'll introduce who we have here today.
Good morning, everyone. I echo Rep. McCormick's sentiments to thank all of you for taking time on your Saturday as well as our BHA and city staff for being here. My name is Katie Wallace. I am the state senator for parts of East Boulder County, so I have all of Longmont as well as Erie and Lafayette as well. I'm very glad to be joining you and get to engage in this conversation with you today.
So we're going to introduce the folks that came to visit with us today and to help answer some of the questions and concerns that you all have brought to us and to them directly. We have 3 members from the State Behavioral Health Administration here. Executive, or
we can introduce ourselves if you want to.
They're going to give their titles, but Kelly and Ryan and Mark are all here from the BHA at the state. And then we have Chief Zach Artis, our Chief of Public Safety here in Longmont. Many of you may already know him. And so thank you all for those of you that sent in questions and concerns ahead of time. We really appreciate that, and sending to us directly, and we forwarded them. And Kelly has accumulated all those in a chart and has those. And I think for the best use of our time right now is to let them speak and answer most all of those questions that they received ahead of time, because you took the time to actually write them down, which is helpful to get through all of the questions. And so, and we'll be up here too if there's any issues that we can address. But now I'll turn it over to Kelly and her team and Chief Artis, and we'll hand you this mic as well.
Thank you. Thank you, Senator Wallace and Rep. McCormick. Thank you all for letting us be here this morning, and you cared enough to take time out of your personal life to be able to be here and ask questions, and you cared enough, or folks from your community did, to do outreach to us to seek to understand. So I really appreciate you for that. I'll have our team do some introductions, but then I'll just jump right into it, because thematically there were lots of very good questions around the certification, the recovery housing piece, and then also lots of questions, concerns around the actual residents themselves and their backgrounds. And so between Chief Artis and myself, with my team, we hope to address the questions and provide as much information as we can. If we cannot answer a question that you have, we will get you that answer. And so we'll write it down and we'll do all that. I brought cards. We're available through email, all of that good stuff. But we want to make a really good faith effort to address the questions that were raised and share with you as much information as we can. So I'm Kelly Kazi. I'm the Deputy Commissioner for the Behavioral Health Administration and oversee our children's care continuum, our adult care continuum, and that's what Mark Condogiani leads. The recovery housing work comes under Mark's domain. And then we have Ryan Templeton, who leads our legislative work. But I'll let you, if there's anything else you want to add.
Sure. Yeah. Good morning, Mark Condogiani. I'm the Division Director for the Adult Behavioral Health Continuum.
And Ryan Templeton, Legislative Director for the Behavioral Health Administration. So what that really means is work closely with our legislative partners about what does behavioral health laws look like in Colorado, and then ultimately how does the Behavioral Health Administration, if it's assigned to us, implement those things. Yeah, so with that, Chief Artis.
Okay. Zach Artis, Public Safety Chief. I think most of you I've either talked to in the last several months regarding some work that City Council has done, but I'm here to answer any questions related to what the city may or may not have done and how that works. But I will turn it back over to BHA and our partners to go through some of the questions and comments that you guys had.
Great. So I'll walk through my part. We'll have Chief Artist answer it, but we're going to definitely then pass around a microphone and make sure you all have a chance to ask whatever questions or ask for more details and all that. We won't talk at you the whole time. So we'll open that up. So in general, there were several categories of questions. We got a lot of them, so we just put them all together. So there was questions around just oversight and governance. What does it mean for the certification and recovery housing, and who certifies, and what is it with this out-of-state group and all of that? Some around enforcement, and then lots around just transparency and public safety. And I'll leave with, it's been several months of questions and interest. And for those of you who didn't get the information you needed or seem like misinformation or whatever, so I apologize about any of that if you were given something that just didn't answer the question or what was needed. So we respond to CORA, the Colorado Open Records Act, but also just, I know folks just reach out and send emails. So if you've gotten any of that information and it wasn't satisfactory, then we hope to rectify that today and be able to provide you with what you need. So let's just jump in. So there were questions around was due diligence, is this a legitimate recovery house, and all of those things. So yes is the short answer. Mobares is a company that does this. For this particular home, they did go through the state's certification process. The state BHA is charged with selecting a certifying body, and that's the Colorado Association for Recovery Housing. CAR is the one that is the certifying body for the state. They are the ones that adhere to national standards and actually exceed those in some places, but they fulfill the national standards, and there's a national association for that too. But they are the ones that fulfill requests for people who want to have a recovery house. And in this case, they are legitimately certified. They met all of the standards. And so in that sense, it is a legitimate recovery house and meet the expectations around that. There were questions about follow-up monitoring, and that can happen. But at the beginning, they did meet the requirements. The hard part is there's the process for certification, but it's relating to what happens in that house and how do you fulfill that for recovery. It does not speak to, BHA doesn't monitor or oversee the residents who happen to live there. And that's where Chief Artist can speak to that. And in this case, your concerns around folks with a sex offense background living there. But on the certification side, they are a recovery house and they fulfill those. CAR went out of business. Some of you raised that recently. And so BHA was on a path to seek another contractor. And them going, that's on them why they went out of business. They're like any other business. That's not BHA's involvement in that. So we have Ohio Recovery Housing is the one that was selected through a sole source contract. Our biggest concern is to make sure, in general, not just about this house in particular, our concern is that when our certifying body then isn't able to, they're going out of business, all that, we want to make sure that we minimize any kind of disruption in these processes so that people who are in the process to be certified, and this is statewide, we don't want disruption with that. If we have houses that are up for renewal, for recertification, it's every year, we don't want disruption in that either. And the recovery housing community advocates around that, people needing it is our top concern. Coloradans need recovery. We want to make sure there's no disruption. So Ohio Recovery Housing is part of the National Association. They fulfill national requirements. We did due diligence of folks on the ground of their experience with them. They're known for being very thorough, very diligent, and we worked with the National Association to help us identify somebody so that there would be as minimal disruption as possible, and that was Ohio Recovery Housing. So we do want to be in state and do all that. We start with that and say, is there anyone in Colorado right now that could do it? And we are led to Ohio Recovery. We had to go out of state, but for somebody very good. So Ohio Recovery Housing is the current certifying body for the state, and we will be doing an RFP in the fall to then put it out to the community, and whoever wants to apply can apply, and we'll vet them and do the selection process and all of that. So just to say they are a good group, the sole source contract, and it was public and all of that, But the sole source contract is for 1 year, and it allows us to be able to put the RFP out, do the good thorough selection process, and then have them on board for the following year. So I get it, we want to be local, but that's the reasoning why Ohio Recovery Housing is in place. So there's that. I have asked them to look at this house in particular. Let's do I met with them, all of that. We double check this. I will reassure you, they're legit. They've done the things they need to do. And we can also go back and do another monitoring and make sure that's still the case, and we will do that. So I just wanted to assure you of that. And then going forward, they are the ones that will do recertifications and all of that stuff. If there is a complaint about this house or any house in your community, if there's a complaint about a recovery house, BHA can accept complaints. We have a grievance process for all of our work. As a state entity, you can access it on our website, submit your information, all of that. And Ohio Recovery Housing, as the certifying body, is responsible for following through on any complaints or grievances related to a recovery house. So they got their contract as of July 1. So we're in like week 2. We will be working with them to make sure it's very apparent how to do that. And no, if you come to us, and people have, not just about this, if they have a complaint about any, they will come to us and use our grievance process. And we will go to then the certifying body, which we did for CAR before, and we will do for Ohio Recovery now. They're the ones that need to be the first on the ground to follow up. It's them as the certifying body. It's their job to make sure that complaint is followed through on, or the grievance. But you can file it in either way, and we'll make sure that that happens. Okay. And again, we'll open this up for questions in just a bit, and I'll have Chief Artist. Let me just look really quick. Complaints. Okay. And so there were questions around who's responsible for confirming that residents meet the recovery criteria. How do we determine when a facility's population or operations align? This is all around enforcement and responsibility. So through the certification process, they have to attest to it. There are regulations and things that they go through, paperwork they submit, policies they do to make sure that this is in fact a recovery house. There might be concerns, you're not the only ones concerned. Are they legitimately doing recovery, or is this some kind of way to mask something else? They are legitimately doing recovery. They've gone through that certification process to do it. And again, I'll have a third party, we'll double check and keep monitoring. But they do follow through on that. The people in the house, regardless of whatever house it is, and again, in this case, you have legitimate concerns with folks with sex offense backgrounds, but regardless of who's in the house, our job is to make sure it is actually a legitimate recovery house. We need to have places for people in our communities, for Coloradans to get the care they need. That is. Chief Artist can speak to, how do you monitor, in this case, the folks in that house? The number of people in the house, that's not related to recovery housing. That's related to other laws and regulations, and how many people unrelated can live in a home. And the chief or others can speak to that too, because you have concerns about 7 or 8 folks in this house, how that's not on the recovery side. And so I just wanted to share that piece of it. But it is our job, and the certifying body's job, to make sure you don't just pass all the muster for the initial certification, that you're legitimately continue to do that in real time throughout the whole year before the recert. And that is happening, and again, we'll have a third party monitor for that. And then there were concerns about transparency of sex offenders living in a community and or in a recovery housing. How do we find out about these things? Why is BHA does not publicize recovery housing, and here's one in your the certifying body responds to people who submit with an interest to do that, make sure they're legitimate and follow the guidelines to be able to do that. Chief Artist might be able to speak to notifications around sex offenders or things like that, but that's not on that certification side to do that. Let me just see if there's anything else, and then, I don't know where, oh, he's in the back of the room. As soon as I cue him, and then he's out, but no, he's still here. And then there were questions about coordinating with local law enforcement, again, on who's living in the recovery house. BHA does not do that. We do the certification process, but then the people living in the house are at a local level, or how that's monitored, in this case with probation or parole. There are lots of folks who live in recovery housing with lots of different backgrounds. And so how they're connected to whichever system is how that monitoring support happens for that. I think I've covered the big topics, but I'll hand it over to Chief Artis, and then I'm going to look back through that list and see if I missed anything that you might have submitted. Should we take questions now, or?
So,
Yeah.
Representative, I just want to clarify a couple of things
Please.
that was said. So most of you, we have talked ongoing about recovery houses and sex offenders. Those are two separate things, and I want to make sure that we're clear on that. What City Council did earlier this year is they addressed the sex offender issue and how many sex offenders could live in one residence. The recovery house is, again, completely different issue. We don't monitor the folks that live in a traditional recovery house that's not sex offenders. Does that make sense? Okay. So I just want to clarify that. There are some regulations that deal with the amount of space that you would need for an individual to live, meaning X amount of square feet per house for an individual to live. It's relatively very small. So when we talk about the numbers, I think there was concerns about, well, how many people can live in a recovery home? Again, it's depending on the square footage of the residence, not based on sex offenders, which is what this community in Prairie Village is dealing with, is a recovery home that houses sex offenders. So understand that the issues are two separate issues. If it's a traditional recovery home that does not have sex offenders in it, we do not monitor, and we do not regulate who lives there. We have nothing to do with the recovery home. The only area that the city would get involved in, if any time we would get involved in, if there was a concern about the square footage of the residence and being too many people not to meet certain life safety standards. The only way we get involved in a recovery home is if there are sex offenders living there based on the ordinance that City Council passed. So if there was another recovery home to open up in Prairie Village, we do not monitor who lives there, what they're doing within the home. The city doesn't monitor that or regulate that unless it's an issue with square footage and life safety. So just want to make sure that that's clear. We do monitor one house because of the sex offenders. They have to register based on state law. And again, so just want to make sure we're clear as we go around and ask questions. I just want to make sure that we're all on the same page from there. So thank you very much, representatives.
Should we?
You want to take questions on what you?
Yeah. Does anybody, let's open it up for questions. And you had one in the back.
Hang on, I'm going to bring you a microphone. And you got to kind of hold it a little bit close.
Hi, so it's kind of a clarification question of what you were just speaking about. My understanding is the individuals in this home do not have substance abuse disorder. That's not why they're in recovery. So I guess, if they've gone through the process of becoming certified as a substance abuse recovery home, but these individuals are not there for substance abuse recovery, how is that working? Right.
Yeah. Thanks for the question. I'll have Mark take that.
Sure. In fact, all the people that do reside there are there because they have a substance use disorder. There are people that live there that are on their path to recovery because of their substance use disorder who do not have sex offense histories. The reason this provider decided to open this up was the fact that people with substance use that were seeking recovery housing to support their recovery journey who had sex offense histories were not getting access to a lot of other places. It was an exclusionary thing for a lot of private recovery housing facilities. They didn't want to work with that population. And so the path for recovery for many of these people was more challenging. So that's why this operator has opened up more than one recovery house, and it's open for anyone with a substance use disorder, including people with sex offense histories. So the fact that they're one of the places that's willing to work and help people on their substance use recovery that has sex offense histories is why there's a lot of people that end up going there with that background.
I have a couple questions. One is a follow-up to that. How has it been verified that these people have substance use disorder?
So again, part of the certification process, make sure that they have policies and procedures, admission criteria, and one of the things that CAR, when they were certifying them, actually put in place for this facility because they knew that there was some background was requiring an attestation from the provider, the operator, that verifies only people with substance use histories are allowed to be here. And they took it a step further, and they make sure that every client that is being admitted also signs an attestation that says, I'm here because I'm seeking support for recovery from substance use disorders.
Okay. So I think my follow-up question, and what I sense is probably a lot of the follow-up questions that we're going to have here today, come from a place of the fact that countless of us contacted CAR, including the city of Longmont, contacted CAR to get more information about their certification process, to get more information about everything you just described, right? And were met with literally no response. So it's very hard to take everything you're saying seriously as valid and legitimate when they were not held accountable to the constituents of this state. And that is why I think many of us are very concerned about now this subsequent organization over 1,000 miles away that has on their website that they're very busy and so they're slow to respond to things. None of us got any responses, including our own city council members, to requests for information from CAR. And we contacted BHA as well, saying that we never got any information from CAR, and that didn't fix anything. So I would like to understand what checks and balances are actually in place to ensure that the Ohio Recovery Facility or facilitator does their job and is accountable to us as constituents, because CAR was not.
Yeah, I appreciate your what sounds like frustration around that, and it's why we are using Ohio Recovery Housing. It's also why we'll put out an RFP and make sure that folks are responsive to questions and all of that to the extent they're allowed to submit. And we get questions that also we're not allowed to. But in this case, you should have gotten an answer, and that's right. And so we are making sure that Ohio Recovery Housing is responsive. And with CAR going out of business and all of that, we can't speak anymore to their lack of responsiveness to what you need. But it is absolutely fair for someone to email, to put in a phone call and say, okay, you might be slow to respond, but not zero response. I agree. And so that's right. It's not a high bar to say we should be getting a response back. So you are that is a legitimate frustration. And so we are actually in daily contact with Ohio Recovery Housing. We are very much involved in the weeds of who's been in the process, who's about to be recertified, who's coming up, how are we going to monitor. We've asked for a third party from them to double check all that and check in on it, and responsiveness. And BHA I hold ourselves and my team to that too. And so, yes, it is hard to trust us given the track record you've experienced with CAR. And all I can say is, in our actions, we should be able to redeem that trust in you to be able to be responsive to the questions that you have.
You mentioned federal quite a bit in your conversation about, the federal standards, the NAR, and, they were using the federal process. Are recovery homes somehow a federal creation?
Yeah, and if I said federal, I'm sorry, it's national. There are national standards. There's a national association.
Yeah, but is a recovery residence a national law or a federal law?
So it's not a law that I understand. There are national standards. This is a private certification because Colorado, some states have chosen to state license recovery houses. Mm-hmm. Many other have chosen to do what our state legislature did in terms of, hey, we're going to use private certification that uses nationally recognized standards. NAR has published those standards. They are the gold standard in terms of of regulating this industry, defining it in terms of different levels. And so that was the legislation we had. Select a certifying body that would use national standards. So when we say the NAR standards, there are other standards out there, but that's those standards are considered respected across the federal agency. SAMHSA even refers to them as well.
Okay, but it's a state, and it's created by the state and state legislation exclusively, correct?
Colorado state legislation said BHA select a certifying body and make sure that certifying body uses national standards.
Okay, but within the legislation, I've read it. There's a primarily focuses, activities that primarily focus on substance abuse recovery clause.
Yes.
That doesn't align with national standards.
Help me understand. Are you saying the national standards don't require
They don't.
substance use as a focus?
There's nothing in your certification standards, and those certification standards that are part of there that specifies that it must only focus on substance abuse recovery. It just within those standards and within your application that CAR's been using, there's simply do you do substance abuse? There's nothing that focuses on what is the primary activity of the business or of the home. And so that's why we're super confused as to why this can exist, because you guys have used a national standard for something that's created by state legislation, and they don't line up.
So I can see the parsing of like what is meant by primary and all that. They have to be in substance use recovery to be able to live in a recovery housing.
Ma'am, I know what primary and secondary are for treatment purposes. That's not what is in the legislation. The legislation says activities at the home must primarily be focused on substance abuse. And I can see where you're going with this. I personally have worked in healthcare for about 15 years. I do some work with BHA, actually, some of your IT teams. I'm a SME for healthcare, HICPUF. And it's different. The primary and secondary and even tertiary, there's a tertiary classification as well. That's not what's in the legislation. It says primarily focused on substance abuse recovery activities.
And I can appreciate, I can hand it to Mark, the attestation that the folks, not just in this home, but in all homes, they have to be in recovery. They have to be able to fulfill the obligations of what a recovery housing is to be able to do that. And
But that doesn't mean that that's what they're primarily focused on.
we can debate the interpretation of that. We are fulfilling that by saying that the folks in that home have to be in recovery and are attesting to that, and that the home provides that kind of support. If there are additional things relating to the people in that home, that can also happen too. They might also need other kinds of supports, but they have to be in recovery, have to need those services to be able to live in a recovery home.
Okay, I would ask our legislators, I mean, you guys have read the code, your state statute that you guys passed. Is that your interpretation of it as well?
Well, if they have a substance use disorder, and that is what has brought them to that house, and they have attested to that, and they have many other things that are accompanying them as a person, how is it, I don't mean to turn the question around, but how do we prove that it's not their primary reason? Oh, okay, so bring that up. Bring that up about the website. Say that about what the website, this particular business is putting themselves out for, because that hasn't come out in this room yet.
Yeah, they've advertised themselves as a sex offender reentry organization. It's all over their website. They don't talk.
They've modified the website to accommodate this guideline to make it look like
Still, when you go out onto their website, the very first thing they talk about is recidivism. They're not talking about relapse rate, which is if they were focused on substance abuse recovery is what they'd be talking about. You guys know that. Recidivism is a criminal justice related activity.
People are fresh out of prison for committing sex offenses, not for substance abuse disorder.
So that's the rub, is that this particular company has set themselves up and out there to the public as a company that
Using substance abuse
takes
tied
this is the basic question, is the fact that they've put themselves out there as this particular company in this particular space. And what I asked you early before you all got here is this an end around for them to, that's the big question, is this particular company seem to have played the game in a way that's now incredibly frustrating.
Yeah, I can appreciate the frustration, and as Chief Artist said, there are two parts to this. Are they legitimately a recovery house and fulfill the national standards? And they do. And are there folks with sex offense backgrounds living in that house? And that's true. So if the house fulfills the recovery housing national standards to do that. If that home was not a recovery house, people with sex offense backgrounds could still live in the house. And so, and so I don't know if Chief Artist wants
So I want
to.
let's get to a question. We'll keep coming around. There's quite a few folks with their hands.
The thing that I brought up prior to when everybody got here with our representative is the fact that Mobaris Solutions is a bogus company to start with. It has no credence. If you're ever in the business world, you don't start a business 3 years after you're on probation for a sex offense yourself and be a sole proprietor. In effect, he has no directors. He's housed on Decatur Street, east of DU, in a junkyard. If you do a Google Earth search of his place, of his business, there's abandoned cars and boats and crap like that all around. And he hides where his primary residence is, which is on 11th and Dallas, just on the northeast side of Lowry Air Force Base. Everybody says he's off probation. He is not. So why would Mobaris be approved to supervise people who are not even as bad as he is in their world? It can't be true. He and Tyler Hendricks, who bought the house, conspired to come to Longmont because the resolutions and the regulations that Longmont had accommodated their wants and needs, and they provided the means to do it by telling these people they were on substance abuse. If you look at all of the offenders that are in that house, it's never mentioned once where they're abusing drugs. They're there for sex offenses, and it's a bogus means. It's like the representative said, it's an end around, and Mobaris himself is a multi-offender, and he took advantage of his position as a dental assistant to offend 5 children, got convicted of 4, and spent 8 years in prison. So he can't supervise these people because he's one of them, and he's one of the worst. So you're keep coming back to the certification. It means nothing. It means nothing. It's a piece of paper, and it's a bureaucratic process that was met because he said, oh, and they take drugs too. Doesn't mean a damn thing.
Yeah. I'll let.
No, go ahead. Go ahead and answer.
business with the Secretary of State. They're allowed to do that. Certainly when we're looking at, an owner of a business, we're, we're gonna verify that they're. Now it's on. Okay, I apologize. There were a couple questions, and I don't know that we're ever gonna, to the first one, there's a deeply held belief that from your standpoint, that this is a place that's intending to treat sex offense as a primary purpose. Okay, okay. Okay. And of course, to become certified as a recovery residence, they need to meet the standards that says, hey, you are here to support people in recovery from substance use. And so feels like there's a disconnect there. I did say, he's been very transparent that he recognized that many other sober living facilities, recovery residences, denied access for people who had sex offense histories. What? Okay, so I'm trying to answer the two questions on the table. One, we're going to have to disagree your assumption that this facility is primarily for sex offense versus.
Not an assumption. It states it on his website. It's how he advertises this facility.
And what I've tried to address is that he's made it clear other recovery residences aren't open to people with sex offense histories, and he is and wants to advertise and say, hey, you have a path to recovery from your substance use too. You shouldn't be excluded. We can serve you, okay?
Benefit from a loophole. So answer the second question, which is what kind of through the certification process, how does the person running the recovery housing, regardless of what other things they may have living in that house, what kind of education or background or therapy, what kind of degree, what qualifies them to be able to run a recovery facility? Is that part of the certification process at all?
I'll have to review the standards. I don't know for sure in terms of ownership, in terms of ownership of a facility. There's ownerships of all kinds of healthcare facilities that may have criminal backgrounds themselves, and it doesn't exclude you from owning a business. I will do some research to see if the standards have any exclusionary criteria for people that have their own past criminal histories.
It's not even the criminal history that bothers me. If he was a sex offender 25 years ago for a very minor thing, it ruined his life, and he went to medical school or became a psychologist and had decided to dedicate his life to make that not happen to other people, I would totally understand that. The problem is, it was a lot more recent than that, it was a lot more severe than that, and he has no training that qualifies him to be in charge of this.
He's still on parole. He's still serving his time. You guys pointed that out to me when you told me, and I asked a question that I should go and report what I'd heard about a violation of the standards to the parole board. Did you know that?
Yes, I'll let Chief Artist speak to managing folks who are on parole and how that works for probation, parole, or that in the community.
I pointed those out to you. You guys don't seem to have any interest in following up on that.
So a couple of comments here, and I may end up using the word we, and I am not voted to speak for everybody here, so forgive me if I overstep my bounds anywhere. First of all, the three of you work for the government. Your job is placing these people in homes. You are here defending that everything you did was correct, that it meets all the regulations and all the certifications, et cetera, et cetera. We don't give a damn about that. There's a house with who knows how many now. It started out 5, then it was 8. I don't know how many people are there now that are sex offenders living in the midst of all these kids in a park and school, and that's what we care about. We don't care if it meets your particular certification or regulation or from the federal government or national government or whatever it is. We're concerned about this house right here in Longmont, and you guys are justifying what you've done, which is understandable, but that's not what I think we're here for. one of the things I wanted to say is you mentioned a couple of times about citizens of Colorado. Do we know, are all the people in that home citizens, formerly citizens of Colorado when they committed their crime? Or are they here from multiple other states that are just sent here for their quote unquote recovery? And with the term substance abuse recovery, that to me rings like the word an alcoholic. You could not have a drink for 20 years and you're still considered an alcoholic in recovery. So these people that are drug addicts, whatever the drug may be, is there a time where after 2 years they've had no drugs and they're now kicked out of the house because they are recovered? Or are they a recovering drug addict for the rest of their lives that get to live in this house? I know that's a lot, I apologize, but.
Thank you for raising that. And again, I'll refer to Chief Artis around the people in the house. The Behavioral Health Administration does not monitor or have a say on who lives in the homes, how they're monitored, what happens with them, or how they're selected. That's with parole, probation, with local law enforcement. So I'll have him speak to that. And I don't know if they're, because we don't connect with the folks, if they're actual citizens or when their recovery or the time of that. That's with local law enforcement and having them transition to community and who monitors them and how their housing is done.
And again, there was the comment of like, we place people who we don't. These are private businesses. They accept applicants who want to live in that facility and they evaluate them, okay? I do want to address the question about how long. There are different types. There's a type of recovery housing that doesn't require certification by law, and that's Oxford House. They have to be a chartered Oxford House, but those are recovery homes that don't have any staff on site. It's people living in recovery that choose to be there. And there are people that live in Oxford houses, for example, that might be in recovery for 35 years, and they choose to live in an environment with other people in recovery because it's what they feel is going to help them stay in recovery. So to answer your question, people in recovery that are looking for a safe, supportive environment to support them on their recovery journey, you're right, they could be in early recovery, they could be in sustained recovery, and so there isn't a benchmark of, oh, you've got, 5 years of recovery, you can't live here anymore. Each business, for the business types, Oxford House again is democratically run, no staff on site. But the facilities that get certified by the certifying body here in Colorado, Ohio Recovery, they will have their own policies and standards for who comes in. Some of them are designed for people in early recovery. Some of them are designed for people that may be in longer term recovery.
Just real quickly, a comment. I was here the first meeting with the city council, along with some other people here. We were moved into a private room to speak to the city manager and to the chief of police. At that time, they looked on their credentials. They did not have a certification at the time that they moved in. We questioned several times about that throughout the process, and even a testimony that was given here before the city council with a comment from Mike Poupon, who is one of the supervisors that lives there, who is a certified sex offender, admitted that they did not have certification when they moved in, and that they were told, oh, don't worry about it. You can get the paperwork filled out later. So this is not acceptable. These people came into this community, this business, without the proper credentials, and the state of Colorado, or you people that are with BHA or the other supervisors, ignored what you were being told and what we were trying to address. And we really want answers about why this happened, how it happened, and what do we do to get these people out of our neighborhood. We have currently 7 felony convicted sex offenders living within 500 feet of the park and across the alley from many elementary school children. Thank you.
Yeah, my question is actually for the state legislators, because I think at this point, all of the questions we're addressing to the BHA officials don't really seem to be getting answered, which is exactly the concern and the problem that we've been running into for months now. So my question for you all, who I believe are responsible for actually upholding the laws that you all helped to write, the state statutes that define recovery residences, the oversight, the process, the frameworks, right, that we keep hearing about to ensure that these kinds of facilities don't negatively impact communities the way that this one has. So my question for you is, do you all feel confident in hearing these responses, the inability to answer the question of why was this person allowed to run a facility? How was he vetted? What was done to ensure that the residents and the certification process was followed? What are we going to do about this? Because this does not seem like it actually adheres to the statute, and it doesn't seem like this oversight is correct.
Thank you for that. I also have some questions coming up in my mind, which is why I'm sitting here frantically taking notes, that I'm not clear that a certifying body, whether it was CAR in the past or going to be Ohio in the future, and being in this in-between space also doesn't feel real secure to me right now. But in their process of certifying a facility, do they have a process or a protocol to actually look into the business model of who is owning or who the business is that wants to be certified? And that doesn't seem to be spelled out in CAR. I don't know about Ohio yet, and again, that's one of the things I want to follow up. Is there more that needs to be done in those certifying bodies that certainly have national standards, but maybe those standards aren't enough? Maybe there needs to be deeper vetting, thank you for the word, of the business model, the person behind the business. I'm assuming that the CAR residents, the recovery homes, do have somebody on site, because you mentioned the Oxford homes that they just decide to live together, but these other homes have somebody that's kind of in charge that lives there. Is that correct?
The person in charge of this house that lives there is Michael Poupon.
Which is what I heard you say. Yes. Right. So how is that person approved, and what is their background? And yes, so are there things written down about them that have not been followed? Or if there's not, sounds like there really should be. And those are follow-up steps that we need to look into, because you're right. That's what I'm hearing, is that there was an opportunity here that he saw that maybe there was no way to be kind of caught along the way because it wasn't there. So yeah, I hear you. Did you want to say something?
I can pass it back to you in a moment. Kelly, if that's okay, although I see that there's a hand up here too, so I don't want to negate the conversation. In addition to the vetting standards that Rep. McCormick mentioned, and the primary definition that Nathan brought up, I would like to sort of see how that's been fit in with the two put together, right? The sex offender treatment we heard from the beginning that you all had identified that this was primarily being, advertised as a sex offender treatment, and so I also have on my list, and so just as we pass back to Kelly, the date of certification and sort of when folks are allowed to move in. I will say,
The city has done a lot of legwork to produce that timeline.
Yeah.
If you need it, so I'm sure they would give it to you.
Yeah, so I will just say both Senator Wallace and Representative McCormick have been very responsive to us over the past few months as we've communicated. There's some issues we talked about from a Senate bill in 2019 that was passed that allowed some recovery homes into residential areas that we're having conversations about, along with the House bill in 24 that increased the number of individuals not necessarily recovery homes, but individuals being able to live in a residence completely. So separate for those. But those have created some operational issues, I think, for cities. And so both of them have been very responsive of having conversations along with that. So and certainly they are taking your feedback, and I'm sure we will have a follow-up meeting after this to talk a little bit more through this. So I just wanted to let you guys know that they are very responsive. They are working with us to look at any options, what the future might hold. So thank you.
On that point, though, you had pointed out to me that folks in recovery are a federally protected class. That
Correct.
is why, I guess back in 2019, aligning state law with folks that are in a protected class are allowed to live anywhere. Right?
Yeah, so
That's at the federal level that.
So I think that's the piece that as we continue to talk, and we have been, to find out whether or not legislators could look at options to limit where they are as far as residential areas, or does that protected class extend to every residential area? So I think when we talk about there's some issues that we have to talk to legal to better understand what legislators can and can't do. And so I just wanted to give you an overview that both representatives have been very engaging in these two issues, along with talking about recovery houses and sex offenders. And so I just wanted to recognize publicly the work that they are doing behind the scenes to work with us, to work with our partners in BHA, to really work through this and make sure that we are protecting our communities, but also giving opportunities for folks for recovery from their substance abuse. So I just wanted to make sure that I gave you the acknowledgement publicly that the work you're doing behind the scenes. And we have a question right here.
Oh, yeah.
Hello. Just by full disclosure, my name is Teresa Simpkins. I'm an attorney and I'm also a candidate for the city council race. What I'm hearing, and I think we're finally getting down to the crux of it, is that from BHA's perspective, this home met all of the licensing national standards. But as Nathan pointed out, in Colorado legislation, it has to be the primary function of the home. And I'm wondering, and your legislative counsel will certainly be better prepared to tell you this, right? But I'm wondering if that's why they put that language specifically in there, because they are a protected class. So for the purposes of homes that truly are devoted to substance use disorder treatment, we can't do a whole bunch of regulating. So the legislature, in their wisdom, probably seeing this loophole, used the word primary, right, to get at specifically that. And to BHA, I would put to you that state law controls over your national standards, right? So if the national standards say one thing and state law says primarily a substance use disorder home, then that should be part of your certification process as well, is a confirmation. And visiting a website seems like a really easy threshold to meet to determine what the purpose of the home is, right? So that may be something to think about when you're talking to Ohio in how they go about, vetting these things, because they're going to have to be in compliance with state law, or somebody's going to end up with a lawsuit that none of us want, right? So there's that. And then my last point is that I would urge you to consider, if you're thinking about writing legislation, that there's plenty of laws that use the terms good faith dealings. And I think that the biggest problem in this city with this home has been the lack of good faith demonstrated by Mubaris. They came into our city, hopefully, given the benefit of the doubt, I'm not sure they deserve, to do something good, right? And then at every turn, when transparency was requested or good faith dealings were requested, residents were met with snark and lack of respect and just generally not a good neighbor dealing. And so I think that that's another thing that we can talk about in our own certifications of these places. There's certainly plenty of legal, rulings around what constitutes good faith. You all don't have to define it. So But I think putting something in there like that would really help, because it would also give residents and city officials dealing with the home that is not acting in good faith some means of addressing their behavior.
Hi there. I have 3 questions, some of them kind of a clarification or making sure I understand. The first, with the relationship between BHA and the certifying, but it sounds like, correct me, that the state of Colorado has outsourced the role of certifying these homes to private industries or private business. It is no longer. Are those typically for profit businesses?
Hi, thanks for the question. So yes, BHA is obligated to have a certifying body that does the certifications, and through a competitive process, and this was years ago for CAR, but will be one in the fall, it's open to whoever wants to apply for that.
Okay. And I would like some clarification on the attestation process, because I wasn't clear, and I want to make sure that there's not like some conflict of interest built in. Did you say that like Mubarak himself said, yes, these people have a substance abuse? Isn't that a conflict of interest, because that's generating clients, that's generating profit? So who tells you they have this is their diagnosis and treatment focus? Them?
Yeah, thanks for the question. And they did attest to that.
Who is they?
Mubarak attested that was.
But doesn't he profit from that answer? Yes. Right, why would, yeah.
So I guess I'll just back up just a second. So I appreciate all the feedback. It's hard for me to hear about seeming like we're being evasive or I'm being evasive. I really want to answer the questions. I'm not trying to be evasive, even if the answers we're given aren't the answers you want to hear, or there needs to like the things that I'm pulling from this, we will definitely are documenting and go, there's clearly whether or not anybody is fulfilling a national standard doesn't mean it's still the standard that is needed, or that there isn't more to be done. And so things like the vetting of every business that's applying, and what are guidelines for when somebody should be allowed to be that vendor, might not be in national guidelines, might not be in our statutes or law to do it. It doesn't mean, though, this isn't raising a good example in which can more be done to do that. So I do hear that. We are documenting that and be able to work with our legislators and all that to be able to do it. And as we think about the upcoming RFP and what that means, we also are balancing that. There are also folks in community around the state that would be great to have recovery housing that have a different kind of experience, and we don't want to set bars in which people can't meet them, can't authentically open up in rural communities, in small towns or big ones, and be able to do the work. So please know that we're hearing that, and we'll be I want to write and pretend and show like I'm not listening, but we are actually, we're going to take this back and do more around how is that vetting, even if you meet a national standard, even if standards don't speak to it or the law doesn't, what is this illuminating for us that might still need to be done? So please know that we'll be doing this and looking into that more and working with legislators on that. And I'm going to have Ohio Recovery Housing do a third-party check. We'll go into more background on this, and we can report back on some of that too. So please know that I'm hearing you on that piece of it. And yes, there are private companies in behavioral health, mental health, substance use, child treatment centers, foster care. There are folks that provide behavioral health that are private companies that do potentially make profit off the work that they do. So technically that might be the case, that by saying yes, they might profit from it for sure.
Okay. And then my last one, sorry, which is not as a slight offshoot, is I don't actually understand, so I could use clarification, that recovery homes have protected status, but the buildings, do they have protected status? I'm curious about like maybe the life, health, safety, but when you change from a residential home to a congregate living home, like were sprinklers required? Or I'm wondering, like, as deterrents to making a profit, you know, does a home, when it becomes a congregate living facility under the residential building code, then need to have these life, health, safety, expensive, understandably, precautions put in? Or can you put like 16 individuals in a residential home just because the people are protected? What is the relationship with the building?
That's a great question. And in fact, it's one of the primary pieces of what the NAR standards focus on is around facility safety and security. It's one of the biggest barriers for operators to just open up shop. They can't just have a residential, a home in a community and be ready to go. Oftentimes there's significant renovation that needs to be made to the building for egress windows and those sorts of things around life safety stuff. So the standards do speak to life safety. So a big part of the site audit by the certifying body is, yes, looking at policies and procedures around are you supporting substance use recovery and those sorts of things. But a big part of it is looking at the facility and making sure it meets those life safety standards. That may not completely. Yeah, yes. To get certified, they had to have a site audit and verify that they met those standards. And those standards include things like egress windows, and depending on the size, may include sprinkler or whatever. There's aspects to that.
Are there public records for like local zoning inspections? Or I don't know the terminology. I'm
Yeah.
out of my depth here.
And there's the one of the distinctions is that, if something was licensed by our office for a treatment facility, for example, our standards do look to say, does this meet local zoning ordinances for commercial? And that's different in recovery residence. It doesn't have to meet commercial, right? And does it? What?
Is commercial different from congregate?
Yes, probably. And so if we were licensing a treatment facility that had 16 beds, it's going to have to meet whatever those types of life safety standards might be in existence. And so we're going to be looking for local fire department to kind of do those things. That is different for a recovery residence that is certified by CAR. That's why they have built in some of those standards, because they don't have to comply with some of those congregate living things as a facility, because they're not really seen as a facility. They're seen more as a house. So NAR built in some standards to address life safety, because those facilities don't have to meet, congregate healthcare type setting requirements.
So let me answer that from the city standpoint, because it really falls in the city's land use or our zoning codes. And so that's what staff has been working through for this last several months, because what we find is that as we increase the number of individuals in a residence, right, we're just talking residential increase, there becomes questions about life safety. So there's a lot of work being done with the IBC and the IFC, which is International Fire Code. And so staff is also looking back at its current and existing ordinances. And so as we see as houses are beginning to increase the number of individuals living in those houses, we are looking through as staff to figure out what additional life safety features need to be in those areas. But just because you are classified as a recovery home doesn't automatically mean you have to have A, B, and C as far as life safety. What we are beginning to look at is, well, when does those things and items kick in based on the number of individuals living within a single dwelling unit? And so that's where we're at, and staff is at, working together before we bring anything to city council to better understand how this is working or the challenges that we see. Because as you know, when you change one thing in one code, it affects 3 other places. And so we don't want to twist something here and make a bigger mess than what we may or may not already have. And so staff is diligently working on that and having conversations on a weekly basis to figure out what we need to bring back to city council to address maybe some of those life safety concerns. So we are working on that piece. Now, as far as what CAR does again, I'll refer to BHA as far as what they inspect, but when you talk about sprinkler system or life safety issues, that is what city staff is now working on, because we did at one time, we restricted the number of individuals that were not related in a home, but we didn't restrict the number of individuals related in a home. And now that it's kind of changed a little bit, we're reevaluating our processes. So again, I don't have an answer for you today. I will tell you the staff is working on this, and we hope to, within the next few months, have a direction to move forward. So I just wanted to clarify that. I don't know what, again, BHA can speak to that from a city standpoint. This is what we're doing and where we're at with that process.
They monitor the people, you monitor the building, the city, like, they monitor the program, not
Yes.
Yeah, good point.
Yeah, so yes, and so there's a lot of comments have been made, I guess, really talking about we're mixing sex offenders and recovery homes together, right? Longmont Department of Public Safety monitors sex offenders within our community, like City of Boulder, Boulder County, anywhere else you find in the state of Colorado. What we don't monitor is necessarily the work that is going on inside of a recovery home. Like, we don't have the ability to do that. That's not legally, we can't see some of those. Some of those things are HIPAA. Some of those things are other things that we just don't have access to. So we don't actually monitor the individuals. Now, again, if there's a fight or something happens, then law enforcement or EMS or fire might get called, right? And we would deal with that issue like we would deal with anyone else that called 911 for services. But as far as the only folks that we monitor, and in your community, are the sex offenders. Again, an example would be there are 3 sex offenders and 9 other individuals who are there getting substance abuse recovery treatment that are not sex offenders. We only monitor the 3 individuals in the home. Does that make sense? And so again, I just want to clarify that. I think a lot of times we're mixing the two with sex offenders, and BHA, correct me if I'm wrong, does not monitor sex offender. That's SOMB, is involved in certifying those things. What BHA does is creates and certifies the program that oversees recovery homes, right? And what the operational and what's going on inside. And so again, there's a lot of different moving pieces, but I wanted to make sure that we're clear. We handle zoning and land use within the city of Longmont. They handle. Right. Right. So that's what, right. So there right now there's no mechanism that says, okay, when you reach 8 people, it changes to this. And so that's what city staff, what we really have is a change of use. And so that's what city staff is working through now to better understand if we change this, how does it affect the rest of the code, to making sure that we get in line and bring it all one time to address those issues. So that is what city staff is working on, is identifying the change of use, and then what does those life safety issues might look like, and so. Not right now. Not as it exists right now. We did go out and do an inspection of bars, and we did talk through some things. That has led to questions in us asking moving forward as recovery homes begin to show up in our community, what do we need to change in our zoning, and how do we address those issues? So those are where we're at now as far as staff working. Yep, sorry.
I'm sorry, we've had a question down here for a minute too. I'll let you know first, and then, thank you. Okay. No, thank you for all of your questions.
So I think what Zach's getting at is when you, and I'm, for you all, I'm the city manager here, everybody else knows me, is in 2019, there was legislation that said, here are this 4 types of housing, recovery residents, mental health, older adults, and it very specifically says will be treated as a single family residence within the zoning code. So that legislation is part of what we're dealing with here, because it very specifically says you'll treat it as a single family unit. And then in 24, there was a separate piece of legislation that took off the limits and regulating by related status, which that is also driven by some court decisions on that piece. And so it is the triggering as a single family dwelling that really shifted our code in terms of what that means, because we have to treat it as a single family unit.
Zoning code and building code the same or different?
Different.
So this is not
No, because the zoning code classifies it, or the state legislation now classifies it as a single-family dwelling unit. So then what we had in place, this is where building and fire code touch zoning code, because it is specifically now a single-family dwelling unit. And what Zach is talking about is on the other side of it, there are homes where you have blended families, where you could have 8 and 10 people living in a home. We have to treat it as a single-family dwelling unit. So if we do something based on occupancy numbers, what does that do where you have blended families, where you have 8 or 10 people living in a home? Because now all of a sudden, that action, this is what he's saying, the negative unintended consequences could be significant when we're working through these issues. And so that's what's making it complicated for us. But what started it was it's treated as a single family dwelling unit.
We have very limited time with these folks. These are city officials. They can help us in the future.
Thank you. And I don't have a question, but I just wanted to state my experience. You said that Mubaraz has been transparent. Everything that's been asked of them has been provided. Back in May, they hosted an open house for the community. They gave the community less than 48 hours notice. They held it during business hours, so a lot of people couldn't attend. So I did, and I asked Mubaraz specifically what kind of treatments are offered here, who is qualified to offer those treatments, and he was adamant that this is all peer support, that none of them are qualified to provide any therapeutic treatments. The only oversight happening, and they had a parole and probation officers there who said they're there 1 or 2 times a month, and that we should feel warm and fuzzy about that. So I'm trying to understand the disconnect between what would really be required of them as a sober living facility and what he's telling the community is actually happening in that house, which is essentially nothing other than holding one another accountable.
And I think this is a big distinction between what recovery housing is versus what clinical treatment and intervention is, okay? A healthcare service that Medicaid might pay for is in the treatment realm, which could be residential treatment, outpatient treatment, et cetera. Recovery housing doesn't have licensed or certified addiction professionals on board. Many of them, most of them actually have certified peers, which there's no state certification for that yet. But there is, again, there's a process where peers can, with their own lived experience, can get training to be able to provide peer support. So most recovery housing works on that peer model. It is not a treatment intervention for anything, for addiction or for any other mental health co-occurring issues that the person might have, sex offense background that they might have. It's not a treatment setting. It is a recovery housing that offers peer support typically to kind of help, maintain people and give people guidance around maintaining their recovery.
So I guess I go next. First of all, I guess I appreciate the fact that you're all talking about wanting to go ahead and take a look at this and see what else can be done in the future, because that's what we're talking about long term. I think my background is in mental health, and I was the state mental health director in the state of Washington. And I can tell you that they had a very good program related to sex offenders and how they operated them in the community. And I would encourage you to take a look at what the state of Washington's doing and how well they've been doing it. So that's one thing. The other thing is, going back to some of the questions earlier, is I have concerns about how, I understand that, there's a difference between recovery and treatment programs. I mean, that's really clear. But I think that there needs to be some knowledge in terms of why people that would be in recovery programs don't have any kind of treatment at all, or if they do, what is it? So if you could address those questions.
Yeah, and I'll add on to it and have Mark to chime in. So the peer setting and all that, which Mark has described in the recovery house, doesn't mean that the folks living in a recovery house don't seek treatment in other places. Just in that house alone, though, is not the treatment setting for it. And so, Yeah, if that helps clarify.
Because I met someone who said they did the treatment, and I talked to her, and she didn't have the qualifications.
You met someone in the house who said that she was giving treatment there.
No, I met someone, no, she was giving treatment to someone who lived in the house. And we talked a little bit about what that was, and we talked a little bit about her background. And to my way of thinking and knowledge that I have, she didn't have the qualifications.
And I think that's the other part. Am I still on?
No, we can hear you. It's working.
I think we're dying, but I'll be as loud as I can. So again, recovery housing can be for people that, like I said, might be in long-term recovery and aren't needing therapeutic intervention anymore, or it could be people in early recovery that would benefit from some sort of concurrent therapeutic intervention. And so it is pretty common that someone might be in recovery housing while getting therapeutic services, hopefully from a BHA licensed behavioral health entity, as is required for substance use services specifically. They need to be BHA regulated outpatient or any type of level of care for treatment, and those have clear standards of clinical care. And again, Colorado is a Medicaid expansion state, so being a BHE opens the door for you to become a Medicaid provider, which is a great opportunity. So you can get supportive housing at a recovery residence while you're getting your therapeutic intervention with either paying out of pocket if you don't have insurance or what?
Those aren't required
That-
to coexist.
Exactly, they are not. They are not.
Any group of people ever who want to skirt whatever laws may be in place by just creating a sober living facility if there's no vetting or oversight.
And you just say, yeah, I am. Yeah, I have a
It's like the box garden.
So the Oxford House model that Mark had described is that, not to skirt, but there are people in recovery who want to live in a common home to do that. So yes, that can happen. And to be in a certified recovery house, it's not a treatment setting, right? So they can be doing peer supports and all that in a sober living environment, fulfilling those standards, yes.
Does it have to be someone who has an offense that's related to drugs or alcohol? I mean, how do we know these people aren't lying?
Right, it's like a trust me, bro.
There's no requirement that someone has a criminal offense to be in a recovery housing. It could be part of their recovery journey without law enforcement pushing them in that direction.
Do you
People
understand
get to-
how they are getting a tremendous benefit in a difference in interpretation of governing housing law, but they are not expected to be held accountable in any way to a substance abuse association. Like, they themselves as a human being can say, yeah, I've been doing drugs my whole life, I have substance abuse issues, and they just automatically get to benefit from all these loopholes. Like, that doesn't...
They become protected.
They become protected, but they don't have to prove it. Like, where's the checks and balances?
Do recovery houses and sober living houses get any state funds?
They can. There is some state dollars that are available that can support people. We run that through our BOSSOs. So any certified, you have to be a chartered Oxford House or a certified recovery home to be eligible, but they have to apply. So there's a lot of them out there that aren't interested in the public funding. They might be catering to a higher priced market versus the public funded market, but they certainly can. And again, many of the recovery housing, they expect people to work. And so it could be people that are transitioning. And so, hey, we're going to get some financial support, a stipend from the state dollars for someone for that first month while they're finding that job. So there is some funding available to support people that need help paying for their first month in recovery housing.
We have a question right here. She's waiting.
Yeah, I want to just address this to the state people mainly because it seems that I think it's HB 1007, the one that allowed for congregate living of non-family people, is the thing that triggered all of this. And that initially was set up so that ski resorts and universities could have more people living, and now we have all of these unintended consequences happening as a result. of people making business models based on it. And Firestone is going through issues because of this. Now Longmont is. I don't know if you're aware about Grand Junction. They have a house where people are being dropped off in handcuffs in a residential neighborhood. My concern is that you have a neighborhood with large houses, that what's going to stop them from buying up 10 houses in that neighborhood and turning them all into recovery homes? Right. And that's exactly it. That the unintended consequences of this legislation that you guys put in, without looking at all the things that it's going to do. And the Grand Junction one, those are, I think, jail people with psychiatric problems. It's not even then recovery problems. And so, I mean, how many different towns are going to have to go through this same problem, and how many houses in our neighborhood are going to be up for sale? And because we have 12 houses for sale in our neighborhood now, and be bought up by different recovery things, so that we have to go through this process each time in order to rectify something that was done at the state level without thinking about any of the consequences that were going to come down through it.
Let me just respond to that, because I really appreciate that. And I know last year one of my colleagues was actually looking into how to put guardrails or guidelines to not undo that, because there's some good that's coming out of that for people in very expensive ways, areas to live, that need roommates to be able to pay the mortgage or yes. And so I know that she's been out of the country for a while, and I plan to follow up with her, because she was already working in this space to try to figure out how do we go back and look at that and find a way to hold on to the good, but to find ways to rein in some of these unintended consequences that you and we are all seeing, because that's quite obvious. And I'm hopeful that there's a way to do that, to do both, to navigate and thread the needle to make sure that we're keeping housing costs low for those that need to have multiple people that aren't necessarily related by blood or marriage, but to also make sure that we're not opening up opportunities for abuse. I hear you with the hurry, and I have that same frustration working in government for now 5 years. It is hard to step on the gas, but boy, do I try. We're there January to May, and that's the time that we hurry. So I appreciate that, and we will do everything we can.
I'll be brief. I'll be very brief. Because I think, again, I'm going to talk to the representatives and the senator, because I think it's in your hands. These guys are doing a great job doing their certification of what you called traditional sober living houses. This is not a traditional sober living house. It's more like a treatment center, should be a treatment center, or a halfway house that is posing as a sober living house. So there needs to be some kind of regulation to get that out of the sober living facility, the sober living regulations, because it was never intended to give people who were just out of jail, sex offenders, that kind of thing, protected status. we all agree that we need sober living houses, and we want them to be overseen. That is also apparent, that it needs more overseeing. I mean, anybody can do it, anybody, that. But the other thing also, and I've been trying to remember this as all this goes along, but the Senate needs to, when you make laws, I know it's hard to see in advance, but you need to consider all of the ramifications that can happen. And these two laws that have been mentioned have made a lot of complications and a lot of opportunities for investors, businesses to take advantage of that, and the general population is going to lose out big time. So the buck stops there. We need your help, and we're going to hold you to it because we need it.
So is there anyone who has not asked a question and wants to ask a question?
Lovely woman right here had her hand up for a while. Oh, I asked mine, yeah,
Yeah,
but this
okay.
lady over here, yeah.
Okay, Councilmember, I'll come back to you.
Just one quick question I have, because I have not done the research and stuff on Mubaraz, and I know a lot of my neighbors have, is this program that they are running something where these folks spend 90 days, 180 days, whatever in this program, and then they are able to move? Gotten no answer, because my understanding is this house now considered grandfathered into the city ordinance? So they're never gonna, these folks that are living there now are likely never going to leave because one has. Okay, good to know. Okay, that was just my question, because my concern is because Mubaraz is very aware that as the people leave their program, this house will no longer be a fit. It won't be profitable, and so they will continue to keep these folks and consider them in their program when they're really not.
City Councilwoman, Longmont City Councilwoman Diane Christ. Thank you all for being here. This has been a real rousing discussion, and thank you for the neighborhood. You have done a great job of answering my questions as we've been going along. I guess my first question was, what good does certifying actually provide? And how often does monitoring happen? It seems like if it's coming from Ohio, the chance of having a site monitoring or just even a check-in is very unlikely. So how long should we expect for a response from the Ohio Recovery House? And I'm just going to ask these and we can go back through them. Is it typically common in healthcare for people to diagnose themselves by personal attestation? I don't believe it is. And we have a business now in a residential area. As far as I know, there's no business permit. There's no business tax or funding shared with the city in regards to this, even though, as you can see, the city is spending copious amounts of time supporting this facility. If it's a business, and we talked about, Mark talked about businesses generally getting involved in this, shouldn't they be meeting a commercial standard? Seems like they should if they're in business and have a business permit. Okay. Here's the thing. I think I understood Kelly to say that their certification was July 1st. Is that correct, Kelly?
No, no, their certification was March, but Ohio Recovery Housing, we're on the state fiscal year. So as of July 1, they are under contract. They are the certifying body for the state. And they actually were the certifying body based on a different kind of funding for the month before.
Okay, so my ask would be, could you suspend their certification until Ohio Recovery has a chance to do a site audit and actually review their position in the city? Are they in recovery or are they housing sex offenders? I think there is a clause with CAR there was that they had to be a good neighbor. Here's one of the things. They're out of compliance with state law. They're out of compliance with local ordinance. We say only 3 sex offenders in one home. And if there are more than 3 sex offenders, those additional ones could find a different home to live in, for recovery. They don't have to all be together, and then they would be compliant. But I would like to see that certification suspended until we can get more of these I's dotted and T's crossed. Yeah. If we could follow the process. Municipalities like process, and we're just not anywhere following our process. And can we go ahead and do that? And I do have, my neighbor here just brought up, and I, what the code actually says. And it says that this recovery facility should provide structured activities and recovery support services that are primarily intended to promote recovery from substance abuse disorders. Would be nice to know if they do have a substance abuse disorder and externally, objectively determined, not just from the participants themselves. Because I think it's really odd to diagnose yourself. I mean, when I go to the doctor and tell the doctor what I think I have, she pretty quickly tells me she'll let me know what it is.
Yeah, lots of questions buried within that. So we'll unpack that and see if we've addressed everything. The local ordinance piece and numbers and all that, I'll leave to local officials and that to address for that. They are doing the activities and that fulfill the national guidelines and their certification. And I'm going to ask for Ohio Recovery to do another check and the monitoring and make sure they're still fulfilling that. And I totally hear folks around clearly you don't like what Mobara's leadership and them as a company and all of that. And so I'll come back to the things that meet the national standards or what fulfill certification might not be the kinds of things as you were describing in real life right now that should be that. And so we are definitely going to take a look at that, definitely take a look at Mobara's and those pieces of it. They might be fulfilling, we believe that they are and did, fulfill what they needed for the certification. And clearly that's not sufficient for what's actually happening or in real life, how it's being used. And we have the complexity of the legislation and the local ordinances and the number of people and how sex offenders are, all of those things playing out in this case. So for our part around the certification and all that, okay, they might have met and did. I won't say might, they did. They met what was needed, and that is insufficient from what you're just, and on our end, we will definitely follow up on those pieces and that Mobara is late and all of that stuff. What's that?
Also on my question, by when do you plan to do that?
Yeah, we'll go back to, it's a Saturday, but on Monday, we'll go back and take that, and we'll work with the representatives and those pieces. So we... Yes, we can do that within this month. We have a couple of weeks to be able to follow up. And so and again, this is the nuance of they might be meeting all of the requirements that they're to meet, and that might be insufficient. And so what do we do with the part that feels insufficient? And we've heard around the local officials around ordinances and those kinds of things. At a state level, what can we be doing to strengthen pieces of it that now we've outgrown or need, or some of those things for next ledge session? And we can be working with legislators on all of that. And we will be working with Ohio Recovery. And again, we're going to do an RFP in the fall, but they're on board. And I'll say this part about the distance and all that. Agree, we don't like the outside piece and all that. They do good work, have a good reputation, and it would be great if we had someone local too. They are committed though to providing local, and they need to. They need to be able to respond locally and be on site and do all of that stuff. So regardless of them being, pardon me? Yeah, so they're going to have local people in Colorado, even though they're based in Ohio and in Columbus. So all of that being the case, we will still have the same expectations of how they fulfill monitoring, support the certification process, but we will do more, another double check on the Mobara's piece, Are they fulfilling everything? And if they are and it's still insufficient, what can we be doing to be able to correct for some of that or improve in those ways to be able to greet that? The part that BHA works on is that recovery piece of it. So in terms of, yeah. Yep. So we'll speak to the recovery part of it, and I'll hand it to Mark. In terms of sex offenders living in community, the local officials will have to respond to that piece.
Yeah, yeah. So if Ohio does a review to verify that they meet both the NAR standards and the state law and that they're in compliance, I think that's where we've had a miscommunication there. You're citing law. We keep saying they meet national standards. I'm saying both. Okay, so if we make sure that they do a verification, are you in compliance with the national standards that state law requires that the certifying body use some form of national standards, and are in compliance with state law, okay, around these. If they do, we're going to let you know, hey, they have verified that they meet these concretely, okay? If they find in any of their audits that someone is out of compliance for whatever the reason may be, they have a variety of remedies, including citing them and saying you have X amount of days to come into compliance with this issue. So it could be one of their windows didn't have egress, fix that right away, right? So they have a variety of options, including suspending. That could be an option. One of many. But yeah, in a lot of cases, it's going to be, hey, you're meeting these 9 standards, but this 10th one you're not meeting. It's not creating an imminent life safety risk, but you need to come into compliance with X amount of days to get your full certification for the coming year.
Hang on. 2 people are talking at once, so. I've gotten the message that we have overstayed our welcome here in the city council, but let's finish up. I'm really glad to have been able to use this space, but I also I want to be able to be invited back.
And thank you, Senator and Representative. I'm wondering what the relationship is between BHA and the municipal authorities. Don't you have to ask that they're in compliance with our rules, regulations, and home rule authority? Don't you care about whether our ordinances are at odds with what they're asking you to certify? And I am assuming you're going to say yes. But how do we work better together about that? Because we did not have any input. We've been talking with the neighborhood since February, and we have not. And putting in core requests, our staff has done an excellent job. But we have not been able to weigh in on this particular facility and the situation, which could have helped solve a lot of this before we got to this point.
I don't know off the top of my head the acceptance rates and all that. You have to fulfill the process. There have been folks who have not met the standards and have not been certified. And so, like any process around a certification, you have to fulfill all of those things to be able to do it, for sure. Yeah, we can look up the number and do all that. And
one thing, we spent too much time on certification, and we don't need to know that this place is certified. One time, say yes or no, it was certified. The person who certified it was Mobares, because he gave you the information about the substance abuse. BHA monitors that. Mobares isn't the one taking the drugs other than what he takes. He cannot confirm what those other 8 people have done or are doing. He hands it to them in order to get the certification. Carr was weak when he went to him in March because they're about ready to close the door. Here it is July, and they closed it up. They weren't certifying anybody. They were going through the motions. You need to understand Mobaris and his quote-unquote business is your major problem, and he cannot be trusted by any means. I've done deep dive on this guy. He has no redeeming qualities that you would want to run down and go down to the pump house and have fish and chips with this guy. It's and I interfaced with him at the open house, rather roughly, I might add. And the son of a bitch turned around and walked away. And I said, well, if you're going to leave, take these 8 other sons of bitches with you. So just
I hear you.
understand, I don't care about your certification. It doesn't matter because it's false. And that's the last question. I hope I haven't overplayed my case.
I just want to, I know you're saying time's up, and I want to honor your time. But I think we want to know specifically, when are we going to get answers? What specifically are you going to investigate, litigate that for us? Exactly. What it is you're going to look at? Who is going to verify those findings? What timeline? Where are we going to get it? And specifically, who are you going to give it to?
Well, I heard that our BHA is going to get answers in 2 weeks, at least the answers that they can get in 2 weeks, that we are going to continue to work with looking at all of the intersection of laws and the overplay of what's been done in the past. We're going to look into the future of this certifying body, which is a stopgap until we can find an in Colorado.
Well, we have to do an RFP. And
Right.
whoever applies, applies. We can't.
Right, and then, so in 2 weeks, we'll hear something, but this is an ongoing conversation where we will have direct communication with BHA, but also Senator Wallace and I have collected a lot of your emails and will also be that conduit for communication as well. And I did put a piece of paper up there. Anybody that wants to be on that email, please do so, because this is not the end of the conversation. For me, the first time in front of all of you, this is sort of the beginning of us being that follow-up mechanism, that accountability mechanism, and what we may possibly be able to do in state law even next session. So Harold. Yes? Thank you for that. We'll follow up with that as well. So thank you all very, very much for coming in on a Saturday. I know this is a hard topic, but it's important for us to be face-to-face and start to get some answers and clarity. So
And we can stay for a couple minutes, but with the fair, we have to move our cars before they're towed too. But I'm happy to stay after also.